As the governor shared, when we last did a press conference, he re-engaged our whole of government response. And so it is great to be joined by so many members of that leadership team, including Lieutenant Governor Matos, our RIDO Deputy Director, Tom McCarthy, Director Liz Tanner, Commissioner Infante Green, General Callahan, Mark Pappas, and of course the governor, among others. We continue to see COVID-19 case rates that are extremely elevated. These are unprecedented numbers that we would not have even imagined last year. Our percent positive has been well above 15% since just before the new year. One of the helpful things is that there are fewer cases that lead to hospitalizations this year when you compare it to last year. However, the sheer number of cases we are seeing now means that our number of hospitalizations is near the levels, if not surpassing, what they were last year. And that's challenging, knowing what our hospitals are facing now in terms of the staffing crisis that has been mentioned. These trends that we're seeing here in Rhode Island mirror what states throughout the country are experiencing. I can say that on the call with all of my counterparts throughout the nation last night. We're having similar challenges that we're needing to overcome. The main reason for this rapid spread, most recently, as everyone knows, is the Omicron variant. We work with many different data and information sources when assessing the variant landscape here in Rhode Island. That includes our sequencing data, which is produced by Dr. Eva King and our amazing team at the RIDO State Health Laboratories. And they also include reviews of the best research available and reviews of our own epidemiological modeling, also done by a great team here in Rhode Island in partnership with the Brown School of Public Health. Based on all of the data and research that we bring together, we're estimating that roughly 90% of infections in Rhode Island are now Omicron. The good news is that we could be nearing our peak for cases and hospitalizations. For several weeks, we've been watching competing variants, Omicron and Delta. And it has been made evident most recently that Omicron is surpassing Delta, most likely because it is much more transmissible. Omicron tends to cause less severe illness, meaning that the peak of the wave in hospitalizations caused by Delta that we are seeing now may be more significant than the peak of the wave of hospitalizations we will soon see because of Omicron. I share this context because we often think about hospitalizations as a lagging indicator, but we may not see that traditional lag here that we've been accustomed to. When thinking about all of this, keep in mind that what we're looking at are projections. They are subject to change, and many variables are in play. Oftentimes, with what we're recommending from a public health standpoint, it is intended to change the projections that we see so that we can make things better ahead of time. So this is why we're doing everything that we continue to describe. Expanding testing, expanding vaccination capacity, ensuring that you wear a mask, talking about boosters and that being available, and imploring that you go make sure your loved ones are protected. We all have to keep our foot on the gas. While there is still significant demand for testing, the measures we've been taking have started to bring our test turnaround times down. For our general public sites, the turnaround time is now just a little over 48 hours, which has been our benchmark. It's extremely important that we have testing availability for people who have symptoms. That's what allows those who qualify to then go and get access to treatment so that they can stay out of the hospitals. If you don't have symptoms or haven't recently been exposed to someone who has COVID, and you don't work in a healthcare or congregate setting, testing for you at this moment is not absolutely critical. We want to truly focus on those who have symptoms, those who have recently been exposed to someone who has COVID-19, and those who work or reside in our healthcare or congregate settings, respectively. Similarly, if you recently tested positive for COVID-19, you don't need to get retested within the next 90 days. However, as I said, for someone who has symptoms, testing is extremely important. We now have many effective forms of treatments, such as MABs that we're referring to, the monoclonal antibody treatments. The first step to connecting a symptomatic person to treatment, which is enormously effective, as I said, in keeping you out of the hospital, is to make sure that they get tested. So please help us in ensuring that we do that with our nation-leading testing system. Shifting gears, the other thing that is very effective at keeping people out of the hospital, which is our primary concern and what this team is going to lead in helping to ensure we address going forward, is what we continue to talk about with vaccines and booster doses. That's an excellent way to keep people out of the hospital, particularly as you heard the Lieutenant Governor mention. If you have not gotten your booster dose, get it as soon as you are eligible. And what I'm excited to share is that we are now offering booster doses to children ages 12 to 15, and so that means everyone who is 12 and older can and must go get a booster dose once enough time has passed from your primary series. Our booster dose basically doubles the protection you would otherwise get from a primary series when it comes to Omicron. And that's why it's extremely important to know now that Omicron is our predominant variant. If you get boosted, you are twice as protected against this variant. And that means your chances of being hospitalized or having more significant consequences are lower if you are appropriately boosted. Even when we're beyond this current wave of infections, the protection you get from a booster dose is going to remain extremely important for whatever other variants come and for ensuring that we get through the rest of this pandemic. This is a global pandemic. With only half the world vaccinated right now, unfortunately, we expect COVID-19 to be a part of our lives in some form or another going into the future. And that's why we have worked so hard to make sure that you have the tools available. We are still going to be facing the current challenges before our entire health system, even after things settle down with COVID. That's our hospitals, our nursing homes, our home health agencies, behavioral health. All of these systems are critical. They've all been impacted by what we're seeing now. This group here at the front of the room and those who are involved will continue the process on behalf of the governor, working with hospital leaders on the capacity issue for the foreseeable future. So what you're hearing from me, from RIDA, we know we've taken care of, making sure you have access to testing with a strong turnaround time that's going to continue to improve, making sure you have access to vaccinations and you go get boosted, making sure you know about how critical it is to mask and to protect yourselves and your families. That is in place. That system is strong for you. That RIDO, National Guard, and other partners have built up and know will continue. What's going to be important going forward is what the governor's whole of government team focuses on in addressing the hospital capacity and other health system challenges that are going to be continuing well into the future. Lastly, we're going to need the continued partnership, and I so appreciate our healthcare provider community going forward. We know that as we talk about vaccinations, our mass vaccination sites have been amazing. They've been great in administering the same vaccine to a lot of people quickly. But particularly as this continues, we're going to continue to develop and strengthen the individualized approach to vaccination, which is what we are most commonly familiar with. Many healthcare providers and practices have stepped up and enrolled to vaccinate against COVID-19 along with the other vaccines that they are administering. But we want to call out to more of our provider colleagues and ask more of you to come on board. We're working to reduce the challenges and barriers to doing so, and we know that's going to be the system of the future that we want to continue to build out to make sure as many people as possible get boosted and continue to have access to what's needed to have full protection. We want to work with you. So please go to covid.ri.gov/vaxproviders, V-A-X providers, to learn more if you are a healthcare provider that has not already joined with us in administering COVID-19 vaccines. Finally, I really just want to thank our healthcare providers out there. Constantly, we are hearing about heartbreaking stories, the sacrifice that they are making, and what they are facing in terms of the challenges, doing the best they can to care for their patients here in Rhode Island. Thank you, our providers on the front lines, and thank all of you as Rhode Islanders who hear this again and again, take on the responsibility of being that ambassador for all of your loved ones with the information that you learn, and for being an enormous partner and patient and flexible and adaptable right along with us. There have been significant challenges along the way, but we have met them time and time again, and we are going to get through this. As I continue to say, we will get through this together.